You know, people used to think that suicide could not be prevented. That's what it was like when I started in the field. But in reality, we now have treatments and interventions that can help people get through suicidal crises so they don't act on them and they don't die by suicide. Most people who die by suicide have a mental health condition, and usually more than one. The most common mental health conditions include depression, bipolar disorder, psychotic disorders, and substance use. But often it's accompanied by post-traumatic stress disorder or eating disorders or other anxiety disorders. So it's important to really get a full evaluation, have a full sense of what's going on with the person, because these disorders are treatable. Sometimes it takes a little work to get them treated, but there is help, and that once you get past a suicidal crisis and you get some help, it's likely that you will not die by suicide. There are some interventions that help you manage a suicidal crisis. So that would be something like safety planning. We literally make a plan of how you're going to get through a crisis, starting with something to distract yourself, like watching a happy movie or a sad movie, or I always like to put breathing on there because it's very portable, all the way to calling 988 for an emergency. Then there are treatments that work to help somebody change their behavior. It's more than just managing the crisis, it's about how to prevent crises. So some of those therapies are dialectical behavior therapy, cognitive behavior therapy for suicide prevention, collaborative assessment and management of suicidality, and attachment-based family therapy. Those are therapies that actually have evidence behind them. There are also medications that can make a big difference, and often it's a combination of therapy and medication that's best. Antidepressants work very well and help a lot of people through suicidal crises and help them deal with their depression. They have a warning that says that your clinician should monitor you if you're young and you might get suicidal ideation. So antidepressants could be a first-line effort. Another kind of medication that's helpful are mood stabilizers. They help you to not have extreme highs and lows so that you don't get into that deep depression. That can help with suicide as well. Then there are other kinds of somatic, we call them somatic treatments because they're like body treatments. And those treatments kind of shake up the brain a little bit, and it works to really get rid of the mental health condition and restore somebody to their usual self. Often you want a combination of those treatments, and the most important thing is to work with your clinician to figure out what's right for you. I wish we had a medication or treatment that worked for everyone. We don't. So it's really about a conversation. If treatment is going well, eventually you should feel like your regular self. And if you don't, talk to your clinician and work it out together. If you see someone on social media sharing thoughts of suicide, take it seriously. They're asking people to know how badly they're feeling and they're in pain. So most social media companies have a way for you to contact them, and they can back channel the person and provide them with 988, the mental health crisis line. In addition, if you know the person personally, direct message them, call them, get in touch with them, and let them know that you're worried about them. If you don't know them personally, but you know someone who knows them, call that person and have them get in touch. When someone's posting on social media about suicide, it's important. Take it seriously. When someone's struggling, one of the most important things is support. And really the way to support someone is to approach them, ask them how they're feeling, let them know you're there for them. And don't judge them because they're not feeling badly on purpose. It's the way their brain and their body are functioning. So go to them, ask them, how are you doing? Let them know what you see. You know, I noticed that you haven't been coming to parties lately. You're not coming to school. Your work is slacking. So just start a conversation with them and then you build on that. They'll answer. So the important thing is to listen and don't judge. Sometimes you're going to ask somebody and they're going to say, I'm fine, and you know they're not fine. So go back to them another time. Respect their distance, but go back another time and check in again. That's a way to help someone who's having difficulty connecting to connect. 988 is the Suicide and Crisis Hotline. It's a number you can call, text, or go online to and get immediate help for any kind of mental health or suicidal crisis. Keep in mind, they will put you on hold to connect you with somebody local, but they will be there for you, and research shows it really helps. For more mental health resources, go to cvshealth.com or afsp.org.